Welcome, everyone. Thank you for joining us in this episode. It's been a little while between episodes, but we're back. Shaun Brewster here with Dalton Yates today, a new fresh face on the podcast. Dalton, you've actually been with us once before. You joined us with another one of our teacher trainees, Amanda. But you've actually suggested a topic for us today, which I thought was a really good one. So I'm going to dive into this. The topic is love what you do, but do what you hate. I thought, what a
Yeah,
great way to sum up what it takes to get good at what you're doing to the point where you can love what you do.
definitely. Yeah,
Tell
no,
me
I
where
thought it
this
was just
idea came from and give us a bit more context.
definitely. Yeah. I thought the topic name was just quite a nice sort of juxtaposition, and the word hate probably is a little bit heavy or a little bit harsh, but it's something that I think we need to do in order to be able to apply a bit of curiosity and apply a bit of open-mindedness in clinical practice so that we don't get left stagnant and unable to progress forward, learn new things, or challenge our previous understandings and beliefs. And it's one that's helped me a little bit in clinical practice, especially more recently. But yeah, I thought it was something that we could have a bit of a chat, maybe about the philosophy behind doing what you hate and why that would be beneficial, and then go into a few examples of how it might work in clinical practice.
Yeah, good one. And I think this is an idea that really sums up what it takes for somebody to become a really well-rounded and complete practitioner, health practitioner. It'd be
Mm,
very easy for somebody to just stay in their lane. And that's a good thing, right? Like staying in your lane is a good thing, but it does narrow or have the potential to narrow your perspective and understanding of things. And so if you're just doing what you love, and in context of that, we mean the things that you understand well, sort of work comfortably with, aren't challenged too much by you like to do, then you can kind of miss the things on the periphery. Dismiss them is probably a better way. You can just dismiss them. And then by dismissing things, you potentially lack context and understanding and a broader, deeper understanding of what else is out there, what else you could be doing, how else you could be helping people.
definitely. Yeah.
Yeah. Do you want to give us an example of something that might be a good suggestion for doing what you hate to be able to do what you love?
Yeah. So I guess one that I've sort of thought of just this week, I might give a bit of context here, listening to another podcast called Philosophies This. The host was doing a few episode series on a philosopher called Simone Weil, and he was just recounting her idea that, especially in sort of Western society, if we want to form a habit, we think, well, I'm just going to grind it out, even if I hate it, and do it long enough that it starts to become a habit. And common examples of this might be runners. And I know that you're in the running space quite a bit. You probably know that after a couple of months, people start to find that they love it. They find a passion for it. And this concept that they were covering in this podcast was, what if we start there? And what if we sort of look at something with a new perspective, or look at it differently, find something about that area that interests us before we start to try and form that habit or start to do that activity regularly? So I guess in clinical practice, one that I've heard quite regularly are therapists that don't enjoy the marketing side or any business areas of their clinical practice. And that's something that they just avoid entirely for different reasons. But, that's something, well, what if you try and sort of change your view on how you market your business or how you engage in social media to something that you do enjoy a bit more, or aligns better with your values before you start engaging in your marketing or social media. So
Absolutely.
that's one sort of, I guess, example. But if we start to look at it, I guess, a bit more clinically, what about in the room with patients? Well, that can be if you're quite closed off to other modalities or other clinical philosophies. Yeah, what if you start to, I guess, look at the success that they might have with other practitioners or in the past in history, and then try and see if there's something that you can find that interests you about that modality or about that profession, and then start there with your research, start there with your reading, and yeah, you might find that you develop a new interest yourself.
100%. That's a really good way of framing it up. That's kind of like leading with curiosity, isn't it? Like anything could be interesting if you can find your way to be interested in it. Like if you
Yes.
can find something to be curious about, and I think that's, correct me if I'm wrong, but I think that's where you're going with this is like, okay, I don't have any interest in marketing my business. I want to deal with patients and humans. Then you say, ask yourself the question, well, isn't marketing just a form of psychology, understanding how the brain works, when people think? Oh,
Yeah.
that's interesting. So I look at it from that perspective, and this is exactly what I did. I got really interested in how people think when they're buying and in the marketing process and the promotions process. And then I go, oh, right, I'm actually interested in this. And then you're more likely or inclined to go and learn something and practice something and get good at something. And so, yeah, that's a good way to start, isn't it? Okay, I don't like that thing. What could I find uh, if I looked hard enough that I could be interested in about it, and then start with curiosity. Very nice.
Yeah, that's right. Yeah, much easier if you do that first step, if you use that as your first step, rather than just trying to grind out for half an hour every single day of reading articles or going on social media and taking photos to do posts. If you start with that first step of how can I make this interesting, all of a sudden it's not something that you need to try and force into a habit. It's just going to be something that you enjoy in your day anyway. So yeah,
Yeah, good
hugely
one. And
beneficial
then
there.
I guess it comes down to still doing the reps though. So if you want to get
Mm,
good at something, it's not, you can't just be curious and then immediately you're good at it. You still have to, that's a nice way to start, but you still then have to show up every day with repetitions, practice, practice, practice. And then I think it's at a certain point there's a tipping of the seesaw and you no longer dislike it. You become
yep.
proficient in it. And even if you don't love it, you can do it quite comfortably and quite happily. And eventually maybe it just becomes part of what you do when you love what you do.
Mm, that's it. I think one other thing that I didn't really get to mention, which I did want to do in a bit of an introduction to this topic, was even making reference to our previous episode where you had Dave Miller on. And I think something that ties that together quite well is he's talking about something quite similar, but more from a exercise and physical therapy perspective. And one thing that he said was controlled suffering.
Mm.
And yeah, I took quite an interest to that term, and so did I. And like he talked a fair bit about some Stoic philosophy behind that. And I think that also sort of like intertwines itself into that idea of how you're saying you start with that curiosity and then you need to put the reps in. And that's where you might have that controlled suffering of doing the things that you hate in clinical practice as well.
Mm. Yeah, good one. Now we've spoken off camera about an interesting thing that went through your mind in the early days of your study, which I thought was absolutely hilarious. Well, this might be a good
Yep.
story to share about how you can sort of go into something going, I don't think that's something I want to do or I'm interested in. And then a bias suddenly builds a brick wall between you and that thing, and it becomes an impenetrable wall until something else happens. You want to tell us that story? I think that's a good one.
Yeah, definitely. So I find this one quite funny on reflection as well. Um, so when I was doing my undergrad training, of course, you cover so many different topics of anatomy and mechanisms and treatments. But when it came to the topic of the lymphatic system and how we can interface with that, or the idea that doing a light massage interfaces with it, the teacher at the time, I didn't necessarily sort of uh, engage very well with their teaching style. So that was a bias that I already had coming into that lesson, or few times that they spoke about it, sort of put me in this position where I was already questioning everything they said, analyzing it, and it wasn't presented in a way that I thought that it should be. Didn't sound as factual as what I would usually like my teaching to be. So I started to think that the lymphatic system was just a concept, just an idea that floats around that, yeah, maybe it's there, maybe it's not. It makes sense if it is, but we don't quite know yet. And I held on to that all through my undergraduate training. And then for about 1 or 2 months, once I was post grad in clinical practice, a few patients would mention it, and I'd just be like, "Oh, yep, yep, that's right, it's there." But it wasn't until someone that I trusted, that had a few conversations with in the past, mentioned it, and I thought, well, hey, like this is someone that I trust, someone that I look up to. They're mentioning that it's real. Maybe I should give this a bit of time, a bit of respect to look into. Whereas previously, if I had thought about it or had a conversation about it, I just totally pushed it away and thought that it's not valuable for me to look into any research or any information about the lymphatic system, full stop. And that's where we want to sort of head with this idea of doing what you hate is identify your own prejudices or your own bias in clinical practice and go and do some reading, do a bit of research on those things that you think are never going to make it into your clinic door. Because obviously, something like the lymphatic system, right? We can't just brush that off. We need to have a bit of an understanding there. And hopefully, I'm not the only one that's been through this. But that was a big, I guess, turning point for me in appreciating that, we can't just shut things out.
Mm.
Yeah. At least
Isn't that
until we've
funny?
done
Like,
some reading on it.
I find that story really entertaining because knowing you as well as I do, I know that you're a pretty critical thinker and you apply logic to most situations. And
Yep.
so even when presented, this is obviously in the early part of your career, even when presented with a new idea that didn't seem to sit well because of a prejudice against a particular style of presentation or the presenter themselves, that concept did not penetrate your brain. It didn't get through the firewall. And so as a
Yeah.
result, you could have lacked any understanding or even comprehension of a system that is vital to the functioning of the body.
Yep.
And as a health practitioner, that's just a bizarre idea. Imagine somebody says, "Oh, I don't really believe in the nervous system. I think it's a bit of a joke. Somebody's just made up the idea of the nerves because I can think things and do things and I just make it happen through the muscles. It's all mechanical." Um, and then that's, obviously that's incorrect. But it'd be so easy to fall into that trap if we just put up walls against everything that we don't necessarily gel with straight away. I think it's a good point you make there. Um, we can take that, and it's a funny example, but we can apply that to so many different things in life. Somebody presents, a patient walks through the door and they have a woe is me attitude. Woe is me. And you are feeling really good after the last 4 or 5 patient encounters you've had, which are really upbeat, positive, forward-thinking people that want to get better, and someone comes in dragging an anchor of woe
Mm.
behind them. And then you're just like, oh man, I don't know if I can help this person. And you helped 5 people before them with the same skill and knowledge and understanding that you drag into this room, but something stops you in that case. And so being able to love what you do requires doing what you hate sometimes. It being getting over that hump with that patient and saying, okay, well, I've got a big challenge here to get myself past this bias that I have towards your attitude. Let's start with curiosity. Let's see if I can kind of find some chinks in the armor and get through to you. And maybe in this session, or maybe in the next one or the next one, we can start turning your thought process around and getting you more positive and proactive and working towards your goals. And then you're back to loving what you do again because you've been able to make a difference for somebody. But I can see how I think I've been guilty of this myself. You walk in and go, oh, here we go, this person again. I know how this goes. They whinge at me for an hour and then they leave and I walk away going, oh God, thank God that's over. But instead, I could be approaching that person like I did the other people that I enjoyed helping, the ones that I like spending time with. And then maybe that person benefits more and I benefit more because of a change in attitude. And that's all
Mm.
it is, really, isn't it? Like accepting that this is going to be harder than the other ones, getting on with it, doing what you need to do to get the outcomes that the person deserves and the outcomes that make you feel more satisfied in the work that you do as well. And it's just
Yeah.
a little flicking a switch on belief, isn't it? Like what do I believe will be the outcome of this exchange, this time, this pocket of time that I'm about to commit to? A bit of belief, a bit of faith that I can actually do something worthwhile here.
Yeah, and that's quite a good point. That made me think just then to add something into this discussion. Um, Talking about you mentioned earlier, like the psychology of people with marketing, and what you were just describing then is something where I guess you could take the psychology of us as humans and what we find satisfaction in can either be extrinsic or intrinsic, and that second person that you talked about, or the fourth or fifth person that comes in that drags an anchor of woe in with them, that's something that we're not going to get a result with very quickly, are we? So there's not going to be that immediate extrinsic factor of or satisfaction of being able to make some success with them. But this is where we can sort of change that belief into traveling that journey and getting satisfaction through that intrinsically, that we're continuing to work with this person. So yeah, that's a huge way that you can start to do what you hate and turn it into something you love as well, is focus on those intrinsic values or factors with each patient or with your media and marketing or with your continued study or continued development. You might be there for the hours versus someone that's there just for pure curiosity and enjoyment of understanding and learning, or learning something that can then benefit their patients. Yeah, there's two greatly different sort of responses between those two students.
Yeah, 100%. I think there's a fundamental underlying principle behind all this, which comes down to when you see somebody who's successful in anything they do, whether it be clinical practice or running a business or sport or, just having a happy life, whatever it is, there's this overwhelming kind of feeling of resilience, I think, that you see in somebody when they are successful. Like, that's a resilient person. They've weathered the storm. They've been through the dips. And I was listening or reading something this morning, and it captured my attention on this, where somebody was saying that, if you can do the hard things, the difficult things, the things you don't like doing, if you can do them intentionally, when the storm hits, when something outside of your control happens, and you come up against something you think, oh, this is going to suck. I'm going to hate this. This is going to be very difficult, and I might not make it through. You've got a reference point in your memory where you've gone, I've done hard things before. I've done things I didn't enjoy. I've done things that were really difficult, that were beyond what I thought was in my capability. And here I am still. I'm still here. And so that's a reference point of resilience. It's like, I know, did that before. I think there's a very good chance I can do this. So I've got that historical reference. And I think that's probably the difference between successful and non-successful people a lot of the time, is they've just got that reference point because they've done the repetitions. They've turned up when it was hard. They approached people and situations that they didn't want to. They did it anyway. They built the capacity, the capability, the resilience, and the knowledge, the self-knowledge of what they're capable of. And then it doesn't matter what storm hits. I can kind of go, I've got the right jacket for that one. I've got the umbrella I need. Cool, let's go. And off they go through it, and they come out the other side, and they're still there, still operating, still practicing, still winning, doing whatever they're doing. Whereas other people might go, hands in the air. I think this one's beyond me. I'm going to step back, and that's the end of their business, the end of their career, the end of their sporting story, whatever it might be, because they didn't know what they were capable of, because they didn't do the hard things. I think that's an important point to take away.
Yeah, definitely. And that's something that you can do in so many different ways, whether you want to apply it to your personal life or in clinical practice. But yeah, I guess one thing about this is that if sometimes you can choose to intentionally expose yourself to those tips, again, back to that podcast with Dave Miller. If you haven't listened to that, go and give it a listen, guys.
Yeah.
Yeah, talking about controlled suffering. If you can give yourself a few of those dips, however frequent that you can handle them to start with, that's going to be something that then you can use, exactly like you're saying, to reflect on when something out of your control comes in. You know that you've already handled a situation very similar to that in the past, or maybe the exact same situation. Yeah, and that's, I think, quite common with people choosing to take cold showers in the morning. Start the day off with something miserable or that you don't enjoy, so that anything else that comes up in the day, you've already done something 10 times worse. So yeah, it's pretty common practice and something that we could look at applying to our own learning, to our own teaching.
Yeah, the saying I used to think of was, if you have to kiss the toad, it's first thing in the morning. Yeah, don't hang around all day thinking about that you have to kiss that toad. Like, just get it done, and then you can move on with your day. Like, if you have to have a hard conversation with somebody that you don't want to have, get it done. If you have to approach a situation that you know is going to be painful physically, emotionally, whatever, just get it done, because just very quickly you'll be on the other side of it, and then it's way better than being on the other side of it.
That's it.
Yeah, good advice. I really like this one. So I think everybody should write this on their wall. Love what you do, but do what you hate. You have to do the do what you hate bit to get to the love what you do bit. I think, nobody falls to the top of the mountain. You have to climb there. If you want that view, you have to put one foot in front of the other and push up through the snow and the wind and the rain and everything else. And it's, we're talking a lot of metaphors here, but the concept holds true, doesn't it? It doesn't matter what you apply it to. You have to do the stuff that you don't want to do. to where you want to
That's
be.
it. I think one more thing as well, Sean, that we often talk about in any classes or conversations with students is the sort of worry of burnout in clinical
Mm,
practice. And one thing that I know I've heard you communicate with students quite a bit is asking them, what do they see? What do they treat? Or, what do they sort of do with their spare time? And usually they're looking at doing very similar things, if not the same thing, every single day. They see the same types of patients and they see the same types of presentations, or they, yeah, just spend their free time in between patients the same way, just scrolling through Facebook or maybe just reading the same information over and over again. And there's not much variety. And oftentimes that can create a bit of burnout. And yeah, I thought this is another practice that we could sort of utilize to help manage that quite effectively. Engage yourself with new ideas or concepts, or sort of even using it as a way to, I guess, proof your own understandings by forcing yourself outside of what you're comfortable with and learning something else.
mm,
At the worst case scenario, that's just going to help you develop some arguments for your own clinical practices, right? And then that can be quite a nice way to engage yourself with the profession entirely and start to help minimize those effects of burnout potentially. So, yeah, I know this is one that we get asked about quite a bit. Is I'm feeling a bit burnt out. What can we do? Maybe this is an idea as well. Doesn't sound very, I guess, uh, smart or simple if you're feeling a bit exhausted or lacking love for the industry to start with the things you hate. But yeah, may definitely help sort of extend your career if
100%.
you
Yeah,
need
the
to.
burnouts, it's a very real thing, isn't it? Most people's career in health is typically somewhere between 5 and 7 years at the
Mm,
most. If we took an average, obviously a lot of people stay there a lot longer. I've been at it for a long time. A lot of people we know have been at it for a long time, but um, a lot of people will drop out in that first half dozen or so years, and that's a real shame. And often people quote things like, "Oh, I just was cooked. My body was cooked. My brain was cooked. I was exhausted. I was burnt out." I think for a lot of people, it can be this feeling of anxiety is not the right word, but inertia might be the thing. Like I'm just kind of stuck. I can't get to where I want to go, or like I feel like I'm in a rut, or I'm not going forward. I'm just on a merry-go-round. And one of the great things to, I think, overcome inertia or even procrastination is another thing that will get people stuck. They don't want to do the thing, or they don't feel like doing the thing, so they put it off, and that weighs on you over time. That can be like a foot on your chest, like, oh, it's that thing that I can't ignore, but I'm trying to ignore, and that's this inertia that you're kind of stuck under the foot. So I think one of the things that often solves that is just small steps forward. What you're talking about is like, okay, I've got a half hour free today because a patient cancelled, or I've got an extended break or something. Maybe I could just do one thing. What's one thing I could do? What's one thing I would do? What's one thing I will do to move me towards that thing I don't want to do? And success breeds success. You get momentum with that. So if I take one step forward towards that thing, I've made some progress. It might have been difficult, but I'll feel good because I've moved a little bit forward and I'm out of that rut now. I've made some progress. And then you can go, well, all right, I didn't like that, but I could do one more of those, couldn't I? If I could just find one more half
mm,
hour, I could take another step. And then within a week, you made half a dozen or more steps. And then within a month, you finish the thing. And it's
yep.
no longer a feeling of a pressure on your chest because that thing's now gone and you can move on to the next challenge. I think a lot of people that suffer from this feeling of, oh, I just can't get myself to do something. If they could just find one thing that they could do that they would do and
Yep.
do that. And it can be the smallest thing. I was listening to a Jordan Peterson podcast one day, and I'm a big fan of Jordan Peterson. He's a very smart man. And he was talking about advice that he used to give his patients that would suffer from anxiety around addressing their small space, like their bedroom, trying to tidy their room, like they just can't get past the idea of doing it. And he said, okay, so what's one of the things that makes your bedroom messy? And this person said, the floor is just a mess, hasn't been cleaned forever. Okay, well, your challenge today before you go to sleep is to get the vacuum cleaner out of the cupboard. And he said, get vacuuming. Well, I didn't say to do vacuum. I said, get it out of the cupboard. Do you think you could just get it out of the cupboard? And they went, well, yeah, of course. Okay, well, get it out of the cupboard and put it near your bedroom door. It doesn't have to be in front of it, but put it near it. Okay? That's your challenge. Okay, do that. And they did that. and they spoke to him the next day and says, okay, did you do? Yes. Okay. Now I want you to put it in front of your bedroom door before you go to bed tonight. So you have to step over it. I see where you're going with this. Could you do it? Yeah, I could do that. And then pretty soon that becomes an obstacle that you have to get over. And like, well, it'd be easier if I just move that. Well, what if I moved it into my room? And these are small steps and they seem ridiculous. Like anyone should be able to pick up a vacuum and vacuum their floor. It shouldn't be that hard. But if you haven't vacuumed it for a month or more, well, then you've got a real mental barrier to doing that. So how can you make it so impossible to ignore or to avoid? Bit by bit, incrementally each day until eventually the thing gets done. And then you feel good about the fact that it's done. And then you realize that it wasn't that difficult after all. You just had to step up and do it, just take action. And it seems obvious at the end of the day, and it should be obvious once you've done it. But the small steps is what gets you there. It's the starting of the momentum. It's the breaking the inertia of the anxiety of that procrastination. And I thought that from Jordan, that was really good advice. It seems so obvious, but I think doing it is the key. Like you just got to action it.
Yeah, that's right. And sort of tying it back into clinical practice now, something that like I struggle with in previous careers and now in manual therapy and as a health professional is a fair bit of decision paralysis, like similar to that procrastination when you're looking at so many different tasks that you have to do throughout the day or different sort of interests that you want to follow. And you just go, I don't know which one to do. Yeah, I've got enough time to get one or two of those done, but I've tried to prioritize them and I just can't put one on top of the other. And the best thing to do is just do one of them. The example is sort of I've got 2 or 3 online courses that I've sort of working through, chipping away at the moment. About 3 or 4 sort of personal projects just on the side. And then, throughout the day, there's always a few things that come up. A patient with a presentation that maybe you don't know an awful lot about, or something later on in the week where you want to go back and revise a certain method or technique so that you can utilize that with a patient if you haven't done something like that in quite some time. So these are the sorts of things where we just need to take that first step and maybe see what's urgent, but then what's important as well, and work on some of those important factors. It's tough to prioritize sometimes, but it's definitely going to be something where you find a lot of benefit.
100%. That's really good advice. Dalton, this has been good. I've enjoyed this conversation. I think everyone can probably take something away from this that they can apply to any facet of their life. And I'd also want to give a little shout out to you for the latest edition of ACE Journal, which has just come out this week. An article from you about values as a health practitioner, which is a great article, I think, is as my feature in that edition. So if you want to check out ACE Journal, you can find that on our website. It's also shared by a bunch of different partners. So you'll probably find it in your inbox now or very soon. If not, jump on our website and check out Dalton's article on practitioner values and getting your framework for thinking very clear so that you can do the best work that you do and love what you do. I think that's what we've been talking about today. So that's great.
Thank you. On the shoulders of giants here. Can't take all the credit.
No, very kind. All right. Thanks, everyone, for listening. That's been a great episode. I hope you've enjoyed as much as we have. And we'll talk to you again soon.
Thank you.